again, when we learn anything, we try to go one directional approach. We have to have the multi-directional approach that gives the better outcome. We can work on that. Pie chart on the sports injury, the maximum chances of the knee injury is quite common in any dynamic movement because lower body engages much more. Carom mein kuch nahi hota. Carom mein only back pain and the shoulder. So depend upon the type of game what we do based on that one. So knee injury is the 35%. Again, these are the interconnected also sometimes. Same person can have multiple injuries, 2-3 joints can be involved, but again we see the primary, secondary, tertiary, categorize in that direction, have approach in that direction, and get the outcome and plan the treatment. So again, the method was the posture assessment. Lot of studies has been done for that. Photographs earlier we are taking. So what we do more in this direction, photogrammetric is more useful. So we click the picture in all the directions, anterior, posterior, both the lateral side, right and left both, and we try to analyze each and every joint. Based on that, we get to know. So eye level and everything. So we have this kind of setting in the clinical setting, where we click the picture for the different, and then we do the marking, and based on that, we try to analyze where all the muscle deviation, everything is there. So this helps us to understand all the directions. We do lateral. We get this kind of data based on that. The green line is showing where it should be ideally. And the so this green line is showing where it should be ideally the body. Red line is where the body is there. So based on this, we explain the patients, like, what all the muscles they have to work more on. Not necessarily each and every muscle is stiff or each and every muscle is stiff. But we try to be holistic approach to head to toe. We try to plan their exercises, and then they work on. And again, it's not that same exercises for a year or something. We keep every 15 days or a year, online or offline, both the whatever the feasibility. This patient is from actually is in Canada as of now. Earlier he was in India, so that time only did. We supporting him based on that one, whatever time and everything. That helps us to be support better. He is in Gopi Chan of Academy. He was here in India for the badminton. He was with the Purpally Kashyap and all. And this all the direction, this gives us very much of clarity. Head, neck, shoulder. Again the hip, knee, and ankle. So all the patients when they come, I always say, if they come for the back and neck pain, also still assess their feet. Why I suggest the feet? So in Hindi terminology, we say, in astrology, they see the palm and tell the future. I tell the patient, again, check your feet and tell your future. So based on that, I do the foot analysis. Based on that, I correct their back and neck pain also. So that helps me to get the better outcome, and reoccurrence I can control. But yeah, controlling the reoccurrence doesn't mean that our treatment only will work that time. Patient have to do their homeworks, what we have done. So planning the exercises for them and their feasibility, again, Bangalore is very fast forward pace. If I'll tell something you have to do consistently so many hours, they say, doc, if you say daily 1 hour exercise is also not possible for me, 30 hours in a month is too much for me, that much of productivity time I have to give something else. Why don't you prefer to be, I'll come once in a month and do whatever you want to do and save my 29 hours. So when we handle such kind of patients, we have to we can't force the patient to quit everything and do the exercises. So similarly, they have their different priorities, but same time, everybody wants to be pain-free. So we try to educate them that their whatever gap time of period, they can use it, and they try to do the homework, and then they get back on track. Always I suggest the patient to have the 30 to 90 days, I ask them to have complete recovery. Why I buy the 30 to 90 days of time? Because anything when we say we learn or practice anything, it takes we get that discipline and habit in 90 days. So that's what I try to buy the time after that patient becomes habituated to that activity, and they pick up and they love to do that exercises regularly. Foot analysis, again, we're using the sensor. So this helps me to understand which area they are engaging much more maximum pressure and the center of the pressure areas. So like this person having more of heel portion and the forefoot engaging, midfoot is not at all engaging. So all this thing gives me the clarity of the type of pain what they have, and what all I can do for them, and what all the activities. So again, only this kind of analysis not gonna help, we'll submit the paper. But what they have to do with that one? They ask that also. So similarly, we have to plan their exercises such a way they can do in day to day, and they can overcome that. Again, I support with even orthotic footwears too, where the pronation and everything, I customize that one. So I've customized insole provision also in my clinic, and I give the footwear also.